498 people in the hospital, and 430 deaths. Our death toll is rising slower than in many places, but we mourn all the same for those who've passed, and we keep all of their families and friends in our prayers. We're continuing to see progress on testing, tracing, and trends. We're hopeful we can enter phase 1 this weekend. However, please know that the success that we've had so far in flattening the curve is due to the work that North Carolinians are doing to stay at home as much as they can, to sanitize, and to keep their physical distance between themselves and others. We can lose ground quickly and cause many more deaths if we don't keep doing those things. Today I'm joined by leaders of the North Carolina General Assembly, and I'll sign 2 bipartisan COVID-19 relief bills that they passed this weekend, providing over $1.5 billion in emergency funding. This is a time that North Carolina has truly come together to fight this disease. These new laws were passed unanimously. Every Democrat and every Republican supported them. I appreciate these leaders reaching consensus with each other and our office to move quickly so that we can test and trace this disease while we also get relief to people and businesses that need it. This emergency funding is just a first step. There will be more work ahead. We need it to repair the damage that has been done by this virus and to look ahead at how we can prevent illness in the future. Early on, we worked together to identify where the state could provide resources for North Carolina's most immediate needs: public health and safety, education, local governments, and small businesses. We know that many small businesses have felt the economic pain caused by this pandemic. Today, I'll sign into law $125 million to help small businesses through a loan program run by the Golden Leaf Foundation and the North Carolina Rural Center. Small businesses are the backbone of our economy, and they deserve our support right now. This crisis is also shining a light on health disparities that have long existed. This legislation includes $50 million for health programs in underserved communities, including our rural areas and minority communities, particularly hit hard by this virus, and that have historically had less access to health care. We know that the sudden shift to remote learning has been challenging for some students and families. Today's bills provide for feeding school children, summer learning programs to help them catch up, and funding to purchase computers for students who need them. It modifies end-of-grade testing requirements and adjusts the public school calendar for next year. The bills I signed today also help hospitals, healthcare providers, first responders, COVID-19 research efforts, and more. They extend driver's license and registration deadlines and waive interest on tax payments, normally due April the 15th. There are more needs, and we'll continue working together to provide additional relief for unemployed workers, people who don't have health care insurance, and other at-risk populations in this time of crisis. I hope the spirit of consensus that brings us together today will continue.